If you're watching this on Moodle or floated by on YouTube, a very warm welcome. My name is Rory Lees-Oakes, and in this presentation we're going to look at an introduction to Cognitive Behavioural Therapy. The father of Cognitive Behavioural Therapy is a man called Aaron Beck, and at the time of this broadcast he's still alive. He's 91 and he lives in America, and he developed his ideas from the research and work of Albert Ellis, who developed a similar therapy called Irrational Emotive Behavioural Therapy. And if you want to know a little more about Albert Ellis's work, then you can find his work on this channel. If you just look in the search bar for REBT or Albert Ellis, you'll see a number of presentations that come up discussing his work. But in this presentation, we're going to look at the work of Aaron Beck. So the idea of cognitive behavioural therapy is quite an elegant one. It talks about how we think influences how we feel, and how we feel influences how we behave, and how we behave influences how we live our lives and the choices we make. And if you think about it, if you have a phobia or a fear, say of flying, say of driving, say of even people, then your life is going to be limited by that fear. It means you won't be able to travel or fly or even go out. And sometimes some people want to make a change in their lives, want to work with the anxiety that comes from not being able to do things, and they seek therapy. And one of the ways of working with anxiety or even depression is cognitive behavioural therapy. Now, cognitive behavioural therapy draws on an REBT view of psychological disturbance, and REBT, just to remind you again, is Rational Emotive Behavioural Therapy, and it works on the ABC model. So let's have a look at what that is. A is action, B is belief, and C is consequence. So an activating event happens, something happens in your life that's an activating event. You then develop a belief from that, and then you live the consequences of it. And I'm going to show you in this little scenario in the next slide how that looks in real life. So let's have a look at what might be called an unhelpful thought process. The situation is you are coming home from work after having a bad day. As you walk down the road, you pass a friend, but she walks by and apparently ignores you. The thoughts that you might generate in an unhelpful thought process are: she ignored me, they don't like me, or she doesn't like me. The emotional feelings may be low, rejected and sad. The physical reaction of the emotional feelings is you might get stomach cramps, low energy, even feel sick. And then the action is go home, avoid her. And if you see that person again, you might want to avoid her, or it might feel just very difficult to talk to her. So that's one view of the world. But it might be that if you went to a therapist and discussed this, they may help you come to another conclusion, which is a helpful thought process. So let's have a look at that. So it's the same situation. You're coming home from work, you've had a bad day, you walk down the road and pass a friend. She ignores you apparently, but it might be a different view. The thoughts might be she looks preoccupied, I wonder if she's all right or okay. The emotional feelings would then change. So once you have a different thought, then your emotional feelings change. So it's gone from feeling a bit sick and nauseous and sad to a concern for your friend. The physical signs, well, there's none. You feel comfortable. You're just concerned about your friend. And the action is you phone them to see if they're okay. Quite a different outcome from the first slide, where you're avoiding your friend, and indeed you're trying to, if you've met them again, it might be very uncomfortable. And this all comes from how you think. And CBT helps you, or the therapist helps you, think about different thought processes and certainly different ideas of what you've seen. Try to interpret them maybe in a different way. So the methods used in CBT are disputing irrational beliefs. What does that look like? Well, say for instance, you have someone who's afraid of crossing the road because they might get run over. It might be that the therapist asks that person to do some research on how many people get run over in any given year. And you might find it's very, very small percentage of the population. So initially, that's the disputing of irrational beliefs. Every time you cross the road, you are not likely to get run over. However, people do get run over, but the percentage is lower than you believe. The second would be doing some cognitive homework. And when we talk about cognitive, we're talking about thinking homework. So it may be that you start crossing smaller roads, or you start crossing your driveway and then build up to crossing a bigger road. You can change your language, and I think that that's quite a powerful way of changing your thought process. So if you say, I'm not crossing this road because it's dangerous and I'll get killed, then almost certainly your thought process will drive you into a position where you're not going to cross the road. But if you use a language such as, this is a busy road, if I cross it without being careful, I might get knocked down or hurt, so I'll make sure that when I cross it, I'm in a safe place, and also there's not a lot of traffic. You're changing your thought processes from one of cannot do to one of can do, with a strategy and a plan in mind. You could use humour. I think one of the most powerfulest ways of defeating things that fear is to laugh at them. So, a therapist, and as a therapist, I certainly would encourage people to kind of be a little bit kind of self-deprecating maybe, and just have a bit of a laugh about it. Not take it too seriously. Admit it's something that's holding someone up, and try and see the funny side of it. Humour really does defeat irrational thinking eventually, I think. It's a really useful tool. Rational emotive imagery. Well, this is about getting the client to think about what it feels like to cross the road. And what you could do is a very simple exercise in that you could get them to walk from one side of the room to another while they're imagining crossing the road and talking about the steps they're taking to make sure they're crossing safely. So in the UK, we learnt curb drill and the green cross code as children, and that was about making sure that when we crossed the road we were looking and listening and making sure that we didn't cross from behind parked cars or parked buses so any other vehicle could clearly see us. So that really brings us on to the next thing, role playing, checking it out, see if it works. Also, shame attacking exercises. Sometimes people with irrational fears are ashamed of it. They think that there's something wrong with them. I've heard the term mental. I'm a bit mental. I'm a bit OCD. And I think part of the therapist's work and building that relationship with the client is to help them unshame themselves from what's going on. Saying to them maybe that, well, this is just where you're at now, but actually there's no shame in it. You're here for help. And lots of other people go through this. So try and take the kind of mallet off your head, if you like. Stop getting people stop you beating yourself up so much. Use of motivation. Well, I guess if you're going to go to work and you have to cross roads, then you're going to have to cross roads. And motivation may be about the therapist saying, well, if you cross these roads, what's likely to happen? What's the benefit? The benefit is you go to work and make your money. And if you don't cross the roads, well, the downside of that is you may not get to work, could lose your job, and could find yourself out of work. Desensitization. Well, this is an easy one for crossing the road. You just get someone to cross the road with you and just keep doing it. And one of the methods in CBT is keep doing something. Keep doing it until it becomes second nature. So in terms of crossing the road, it would just be crossing the road again and again and again, using the skills that you've used, i.e. making sure there's no traffic coming, listening for cars, making sure that you can get across the road in the time you've got. And slowly but surely, you desensitize yourself from the fear and are able to cross the road without a second thought. And skills training, well, if we stay on the theme of crossing the road, that will be about teaching people about how to cross the road, where to cross the road, what to look out for, what to listen for, and also maybe using the crossing, using the pedestrian crossing. And assertiveness training. Some people who find it difficult in life aren't very assertive. So sometimes it's okay to teach the clients how to be assertive, and importantly, the difference between being assertive and being aggressive, asking for what you want as opposed to barging in and bullying for what you want. An important skill in life is assertiveness, being assertive. So let's have a look at Beck's cognitive therapy in a little more detail. Well, it's called insight focus therapy, and that means it emphasises changing negative thoughts and maladaptive beliefs. So it changes negative thoughts into more positive and reality-based thoughts, and also looking at beliefs and testing them against reality. The theoretical assumptions are people's internal communication is accessible to reflection, i.e. those thoughts we have in our heads that can hold us back, they are accessible and we can change them. If we think about it and think about other solutions, then we can change our behaviours. It respects clients' beliefs and they have highly personal meanings. So a therapist in CBT wouldn't dismiss someone's beliefs, but they try and work with them to change them in a way that are more beneficial to them. And more importantly, the meanings can be discovered by the client rather than being taught or interpreted by the therapist. So there's an amount of therapeutic, almost person-centered approach here, where it's not an analysis of the client, it is indeed the client working out where these thoughts came from and where did they first come and why is it that their thoughts are holding them back. Perhaps thinking about the activating events. So steps to changing dysfunctional living are acknowledging we are responsible for creating our own emotional problems. So taking responsibility and ownership and saying that, we can change the way we live and the way we think about situations. That's a really important step. And I think about 90% of the therapy, once someone's decided to change, then change is possible. Accepting we have the ability to change disturbances significantly. So having the belief that we can have a different view of life and we can live our lives differently. Recognise that emotional problems stem from irrational beliefs. So the idea that those emotional problems, sad, happy, angry, could come from irrational beliefs, things that aren't true, but we perceive them as. The ability to clearly perceive these ideas and these beliefs. So if we talk about crossing the road, understand that the problem with getting to work is crossing the road and the reason that you cannot cross the road and the faulty belief. Clients have to believe that seeing the value of the therapist disrupting the self-defeating belief is valuable. So if you have a client who you're saying, well, look, if you use the crossing lights at the road, you'll be able to cross. If they can see there's a value in them disputing the irrational beliefs, that's fine. But if you get a client that says, well, I still might get run over, then there's some work to go. So people have to really want to change, and that's the sense in any therapy, isn't it? And 6, accepting the fact to change, we must work hard in emotional, how we feel, and behavioural ways, what we do, to counteract irrational beliefs and dysfunctional feelings and behaviour. In other words, we have to make the change ourselves. And as I said before, keep doing it, keep repeating the new ideas and the new behaviour until they become second nature. So let's have a look at irrational ideas from the CBT perspective. Well, irrational ideas lead to self-defeating behaviour. Some examples: I must have love or approval from all the significant people in my life. How logical is it that everybody you'll meet will love or approve of you? It isn't. There's people in life that will never love or approve of you, and that is just life. So people have to kind of get that idea into them and believe that not everybody's going to love or like them. Some other irrational beliefs are: I must perform important tasks competently and perfect. Well, as I've said to clients on a number of occasions, there's nobody who is perfect. And sometimes that comes from childhood. It comes from parental intervention where children are told they have to be perfect. and they grow up with this activating idea and this belief that they have to be perfect. And sometimes it's a relief to be told, well, actually, you don't have to be perfect. And if the therapist, and I would say this, I'm not perfect, I make mistakes, I make loads of mistakes, that's fine. And if they can see the therapist isn't a perfect person, they make mistakes, then it's certainly easier for the client to see that in themselves. And what's called awfulization. If I don't get what I want, it's terrible and I can't stand it. And, there are people who just cannot stand not getting what they want. Well, the message is, unfortunately, we cannot always get what we want. And sometimes if we want a happier life, we just have to find ways of living with the fact we can't get all we want. So those are some ideas of irrational thinking. Practice makes perfect. The therapist will challenge or dispute irrational thinking. So that's the therapist's job, to help you think in a different way, or help you look at the situations you find yourself in from a different perspective of thinking. The therapist also encourages the client to practice new thought processes and check thinking out against evidence. So if we go back to crossing the road, the client would be crossing the road, would be trying to cross the road and actually checking out how many times they cross the road, how safe is it, using the new skills. So it's about practice, and the idea is that once you practice and keep practicing, like with any other skill, it becomes second nature. And if you think about driving, when you first start to drive, if you're a stick shift user or use a gearbox, as we do in the UK, it can take forever to get the right gear and the right pedals in place and that type of thing. And then one day when you've passed your test and you're going to your work or you're going to the office or going home, you realise that you've really had no conscious idea of how you've changed gear or how you've used the clutch or how you've driven. And that is because it is a subconscious thought process done from practice. Practice makes perfect. So the more you practice, the better you'll get at any task, and that includes your life, I guess. If you want further information, if you're watching on Moodle, I'll put some information on REBT sites, a little bit about Aaron Beck, so that you can see a little bit more about his life and his work. If you're watching on YouTube, if you click the arrow below in the space bar below the video, I'll put a link on to the REBT video so you can watch the origins of CBT, and I'll also put some links onto other CBT sites so you can get a really good idea of what cognitive behavioural therapy is and indeed what it does. And finally, thank you for watching.